So let's talk about how you'd execute on this information. Without the insights, a traditional PRM-managed physician outreach organization that did not have the layers of information that we just talked about might have a regular interaction with Dr. C and might ask a general question. How is our network of specialists serving your patients? Well, Dr. C might give you some platitudes. He might answer, they're doing fine. I send them a lot of patients. Everything is good. If you have a good relationship with them, you can probe maybe a little bit further and ask if really everything is okay. But are you going to get a lot of feedback from Dr. C? That's why we ask, is what you're getting as feedback from your physician interactions the truth? But with the insights, we actually know that Dr. C was referring patients in gastroenterology to a physician, Dr. F, and we can tailor our question and ask, what does he like about Dr. F and how he treats the gastroenterology patients of Dr. C compared to the in-network specialist, Dr. S? Recall, there was no in-network provider, for all intents and purposes, that Dr. C sends patients to. Now, you ask a focused question, you likely are going to get a more detailed answer. In this case, imagine if Dr. C responds that he doesn't know Dr. S. He'll tell you he remembered that when he joined the organization you made an announcement, but he'll tell you that he's been sending his patients to Dr. F for a long time, and he might also reveal that he's heard some scuttlebutt that Dr. S is really busy having come on to the organization, and that he doesn't like for his patients to have to wait for a long time for a follow-on consultation. Well, that is very specific feedback that you can start to act on. First of all, you might say back to Dr. C that you're going to check into this question of whether Dr. S is actually having scheduling challenges. But more importantly, you're also perhaps going to apologize that Dr. C has not met Dr. S yet, and that you'd like to bring him by so he can discuss his patient expectations and perhaps get comfortable with him. And then, you know, as part of your closing statement, you might say that after that all occurs, that Dr. C might test the waters and send some patients to the in-network provider, Dr. S. That may be a very abstract thought, but let me kind of bring it all together. At the end of the day, if you have a PRM system that has actionable market intelligence, you can understand your opportunities better. It helps you focus your engagement with whomever you're interacting with, those you have good relationships with and those you don't have relationships with, because you can ask specific questions. You get real answers, and that can inform your follow-through. And of course, you're going to log that activity in the physician relationship management tool. And depending on what kind of follow-through it is, you can also make it accountable, such as in an issue management system.